I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today's health question is, what can we do to help prevent back pain? Pretty important topic, especially for me. I have lots of back pain. What can I do to prevent it?
I think it stems from what's causing your back pain, but I think a lot of it has to do with strengthening your core musculature, as well as strengthening your glutes, as well as your hamstrings. I think as a society nowadays, we sit too much. The New York Times came out with a great article quoting, the new quote was, "Sitting is the new smoking." And I think that has a lot to do with the fact that when we're sedentary and we're sitting, our muscles aren't being activated. And then,
so what would you recommend a middle-aged man or woman do to strengthen their core musculature? I mean, I know there are back exercises on the internet.
No.
What do you say?
So I think a lot of it has to do with stretching, because I think as we sit, our muscles, they don't work, so their resting length gets smaller. And then exercises like planks and push-ups and everything that kind of activates your abdomen.
How about crunches? Because that sort of crunches your back too.
Crunches are good too, but one, you got to make sure your form's okay. So to be able to do a good sit-up, I think you have to work up to that. And so I think just sitting around and doing a couple of crunches isn't gonna do it. So doing a variety of different exercises, really just focusing on your flexibility as well as your core musculature and your legs is very important.
And anything to stay away from?
I think as long as your form is okay, that's great. Patients nowadays are doing a lot more of the Olympic weightlifting and CrossFit. We are seeing a lot of injuries because I think patients are trying to put up too much weight with poor form. So I think that is one of the kind of the more important things to look at is your form.
How about walking?
Walking is probably the best thing you can do. I encourage all my patients to walk as much as possible. Even patients that just had surgery, I tell them at least every 45 minutes get off the couch and walk, or get out of the bed and walk, just because you don't want to get stiff.
Incredibly important.
Yeah.
Thank you so much.
And that's great advice.
If you have a health question for a doctor or would like to suggest a topic for a future Health Talk show, we would love to hear from you.
So please send your question or comments to healthtalk@wchn.org.
Thanks for watching. We'll see you next time.
Bye-bye.